My name is Dr. Bojana Jankovic, and I would like to talk to you about vitamin D. Now, you probably know that vitamin D helps with bone strength. But I get many questions in my office about, am I vitamin D deficient? How much vitamin D should I take? I've been told one thing or another thing, and there are many myths about vitamin D that seem to be going around. So I would like to tell you a little bit about what the evidence is, what the recommendations are, and what you should talk to your doctor about. So number one, we know it helps with bone strength. Very important. Especially people who have osteopenia, meaning loss of bone density, or osteoporosis, which is even more severe, they definitely should be taking vitamin D supplementations. But even healthy individuals should be taking vitamin D supplementation. But first, let's talk a little bit about other possible roles of vitamin D in our body. It has been implicated in boosting the immune function. There are also some studies that link it to cancer prevention, including colon cancer, prostate cancer, and breast cancer. However, these studies are still controversial. It also helps to prevent and possibly even treat diabetes, heart disease, and high blood pressure, but this is still under current study. So many possible implications and benefits of vitamin D, but we're still learning more and we just don't know enough. But we do know that it helps for our bones. So, what are the sources of vitamin D? Well, of course, the sun. So spending time outdoors is certainly going to help with that. But we do have to be careful about UV radiation from the sun and risk of skin cancer. Another source would be from diet. So for instance, fatty fish such as salmon or tuna, cheese, egg yolk, or fortified foods such as milk, yogurt, and juices and cereals. But I don't typically recommend those because there's too much sugar. Another source would be supplements. So how much is recommended? Well, if you're between 19 years old and 70 years old, you should probably be taking 600 international units of vitamin D3 per day. However, if you have other medical conditions that impair the ability of your body to absorb vitamin D, you may need to take more. If you have already a vitamin D deficiency, you might need to take more for your supplementation. Or if you have osteoporosis or other problems, you again might need to take more. If you're over 70 years old, the recommendations are 800 international units daily of vitamin D3. Almost half of the people in the United States are vitamin D deficient. Who's at risk? So older adults, people who spend most of their time indoors, people who have dark skin, people who have inflammatory bowel disease or other problems that make them unable to absorb sufficient vitamin D, such as a history of gastric bypass or obesity. If you have any questions about vitamin D, whether you should be tested for it or how much you should be taking, please talk to your doctor. I hope this information has been useful to you. Thank you so much for watching, and please feel free to comment or ask any questions or suggest ideas for future topics. Thank you.